Last week, the financial regulator issued guidelines for what it called Healthcare Research and Development Intervention Scheme. This is keeping with a statement made by the Central Bank Governor Godwin Emefiele to mainstream the healthcare sector in the economy when the outbreak came in March. Speaking with us from our Abuja studios now is Yila Yusuf, the Director of Development Finance at the Central Bank of Nigeria. Good evening, sir, and welcome to the program.
Thank you, Boston, for having me. Good evening.
We appreciate your time. What does the CBN, Central Bank's Research and Development Intervention for the healthcare sector, what is this scheme looking to achieve?
Okay, thank you, Boston. What the scheme seeks to achieve, if you recall, one of our policy responses to the COVID saga was to create a healthcare support fund for manufacturing and other hospitality and healthcare-related industries to access through the bank. Another area was to look at how we can, create a grant, a scheme where either research institutions or those into manufacturing can access grants to be able to either find vaccines, provide drugs, or other herbal medicines that can respond not only to COVID, but to other communicable and non-communicable diseases that affect our people. So really is to create some form of innovative financing mechanism and also to spur R&D in the healthcare industry.
So you released the 7-page document just about a week or so ago, or about 2 weeks ago. What are the guidelines that everyone should be aware of, and how will it be funded and managed?
Okay, it's going to be funded from our MSME fund. There's a development component of that fund. 220 billion is the size of the fund. There's a development component that will be used to support the grant. The main thing to note in the guidelines is that there are two key areas. There are those who want to go into research. There's a maximum of 50 million naira that is available to be disbursed, and those who are into manufacturing activities, there's a maximum of 500 million naira that can be accessed. What the central bank has done is to form a body of experts who will administer this grant. That body of experts was inaugurated 2 weeks ago by the Secretary of the Government of the Federation. It's led by the DG NAFDAC. It consists of both independent research specialists and also government research institutions. The NCDC is there, the National Pharmaceutical Research Institute is there, the Center for Medical Research. Quite a couple of institutions are represented on the board, and then we have two independent research experts who are quite versatile in administering these grants and also have been into research of vaccines to complement them. So they will administer the grant, and then anybody who is eligible can apply. The modalities are set out in the guidelines. They will look at the proposals and then evaluate them, recommend to CBN, and then we'll eventually disburse. As we speak, as at today, we have received over 34 applications asking for 90 billion naira. What is exciting is that 90% of those applications are coming from our universities. So we're looking at how we can quickly get those proposals to the body of experts. They look at that, and then we can disburse the funds.
It's very interesting to know that universities in Nigeria are stepping up to this. Is this a mix of more of public or private sector universities?
Both of them, both public and private sector universities, and also some of the manufacturing companies in Nigeria have also applied for the grant. So all this will be looked at by the body of experts, and they will make our recommendations. They've already set to work. You should be seeing some of their communications in the newspapers some coming days, asking for more clarification for some of the proposals that we've received. They've tried to streamline the format so that they can easily score them and make the submissions for CBN for approval and eventually disbursements to the successful candidates.
In terms of a few details, Mr. Yusuf, in terms of at what rate will this fund be accessed, and is there a sunset clause as to when they are repayable and things like that, and other details like that?
Thank you, Boston. That's an interesting question. This is a grant. It's not a loan. They're two. So to make the clarification, for our policy response to the healthcare intervention, there's a site that is set aside for the fund, which is a loan at 5%, and now for the first year. That's the 100 billion one, and we've funded over 24 both manufacturing and healthcare centers. We've disbursed 30 billion. 2 of them are brownfield, and the remaining are greenfield projects, most of them to maybe increase their lines for the drugs that they manufacture. One of them is a funeral center that we've also funded, but this particular healthcare and research sector, it's a grant, so it's not a loan. We're going to be funding it from the development component that exists out of that 220 billion MSME fund. So it's a grant, it's not a loan.
But is there a sunset clause for those who are receiving it?
Yes, we, like I said, in the next few days, you will see some communication from the body of experts. We're expecting that all submissions from those who are applying should be before the end of 30th of October. And then there's a sunset clause. We've set 2 years, 24 months for us to be able to disburse. The disbursements are not going to be bullet payments. Like, you know, when you're doing research, we'll be doing it in tranches and based on progress. Once we see milestones, then we'll disburse. We're not going to be making bullet payments, so that indeed we want to ensure that the grant is administered properly and that we have successful outcomes.
Well, in terms of how this intervention scheme tie into other, what you call healthcare initiatives of the government in relation to COVID-19, how does it all fuse in together?
I think this is a complementary effort. I think as a central bank, we've really, Governor Emefiele has been worried about the huge outflows that we've been spending on medical research. I mean, both medical tourism and also the cost of drugs that we purchase, especially from Asia. The numbers are quite staggering. Yes, we do not have APIs yet in the country, but we believe that with adequate research, we can bring down the prices of drugs, especially around herbal medicines. We should be able to do something in that area. So this is a complementary effort. We've been working with the fiscal authorities. Like I said, if you look at the composition of the body of experts, a significant part of it is from the fiscal side, the government side. So they are the ones that are going to be administering this grant. So it's a complementary effort, largely to look at how we can improve the healthcare system. So yes, the 100 billion is there and it's being drawn down, and quite a lot of pharmaceutical industries and also some of the hospital-based some people in the hospital industries have also benefited from it. And this is a grant portion really to spur that research and look at how we can, you know, bring down not just COVID, like I said, but other communicable diseases will benefit. So it's quite a complementary effort.
So in terms of the alternative medicines, or what you call the herbal medicine, what are you learning over the last few months that your engagement has been with this healthcare sector, and in terms of, are they part of the research? Are they part of those who want the grants? Because these are folks that are indigenous, 100%.
Yes, and that's why if you look at the guidelines, we really ensured that they're carried along, they're captured. And what we've been learning over time, like you said, is that quite a lot of the applications that have come in surprisingly from the herbal medicine side. And we're going to be giving them a chance. We're going to be giving them an opportunity. It's going to be a fair treatment across board for those that are formal and the herbal medicine side. And we're looking at the body of experts who are diverse, who are experienced, to be able to ensure that you know, some of the grant does go to that sector.
Thank you so much. We appreciate your time. Yila Yusuf, Director in charge of Development Finance at the Central Bank of Nigeria.